Good afternoon, everybody. Welcome to DPC's Roundtable. It is Donate Life Month, and we're so happy to have two guests with us, and of course, our medical facilitator, Dr. Scantleberry. We are just going to have them introduce themselves. We'll start with Talia, and she'll tell a little bit about herself, and then we'll go to Colleen, and then Dr. Scantleberry will go from there. Thank you for joining us. Talia?
Great. Thanks, Nancy. So I'm Talia Giordano. I'm a licensed clinical social worker with Gift of Life Howie's House and Gift of Life Caregiver Lifeline program out of Philadelphia. I've been here with Gift of Life for 15 years now, working with transplant patients and their families. And prior to this, I was a dialysis social worker for about 3 years with DaVita here in Philadelphia. So lots of experience working with kidney patients and families and end-stage organ failure.
Colleen?
Okay. Hi, everybody. My name is Colleen Brand. I am the volunteer coordinator here at Gift of Life Donor Program. I've been at Gift of Life for about 4 years, and I have the pleasure of working with our volunteer ambassadors, many of which are transplant recipients, specifically kidney recipients. So it's a wonderful job to have, and I love working with folks and getting to hear their story. So thank you for having me.
Thank you. Dr. Scantleberry, it's all yours.
Thank you so much, Nancy, and good afternoon, everyone, and welcome to DPC's Facebook Live. I am Dr. Valma Scantleberry. I'm the medical facilitator here for this program this afternoon. And as you were told, April starts the donor month and donor recognition, and it's all about what we can do to increase organ donation so that we can get more patients transplanted. And unfortunately, each year, I should say, fortunately, each year we have more and more people being transplanted, but the list is still growing, and we really want to talk about how we can get a better understanding of what it takes to donate. What are the myths? What are the barriers that you encounter when you talk to the public? And so, Colleen, I'm going to reach out to you first to say, how do you address the public, and what are the myths and misperceptions that you encounter when you're out there volunteering and meeting those to encourage them to donate organs?
Oh, thank you. So yeah, it is, as Dr. Scantleberry said, it's Donate Life Month. So we are all hands on deck right now out in the community. So we hear a lot of different myths and misconceptions about donation, about transplant. And as a team, at Gift of Life and at Howie's House, we work very hard to dispel them without making people feel foolish or wrong for feeling how they feel, right? There's a lot of different reasons that people are skeptical about the work that we do. So we understand that a lot of the myths come from places of genuine fear and concern for someone's well-being and for the well-being of their loved ones. So really the basis or the foundation is that we work with people to make sure they're comfortable with and understand the process. And I think the most important thing is welcoming questions, concerns, and conversations about about donation in its entirety. So I think the first myth that we hear, or the most common one rather, is that if I'm taken to the hospital and they see that I'm a donor, they won't try to save my life. And I see Dr. Scantleberry shaking her head. So I don't know how you would dispel that as a medical professional, but we say simply, the one and only concern when you're in the hospital, the healthcare team is there to save your life. So that's kind of how we operate. We say that, but I think it's really helpful when we have volunteers who have the medical background. And, like we have some volunteers that are nurses, or, they've worked in a hospital before, and it's really helpful for them to share their insight. Another common myth that we hear is that I'm too old to be a donor. And then I think in the state of Pennsylvania, the oldest donor that we've had was 97 years old. And that woman donated her liver. So we hear that a lot when we're at senior fairs or out in the community. Someone says, oh, you don't want these parts. I'm far too old to be a donor. And then we also hear in conjunction with that, people say my medical condition, would make it impossible, or I have all of these ailments. So what we tell people is your age or your medical history does not determine whether you can sign up. So you can still sign up. And then at the time of your passing, the team will come in and assess if you're able to be a donor. So it doesn't negate people from signing up. We don't know if someone could be a donor by just talking to them, but we do encourage them to still register. And I think the last and most common myth and misconception is people say, I'm not sure if my religion supports donation. So we work with people from all different backgrounds, faith backgrounds. We're in, especially in the month of November, we really focus in on houses of worship. And I think the most important thing is to note is that most major religions do support donation and see it as a final act of love and generosity towards your neighbors. I'm not comfortable speaking specifically about certain religions, but I do say kind of that general, just in general, it's seen as a wonderful act of love and generosity. But I think really and there are a lot more myths and misconceptions we hear, but I think those three are the most prominent. I think the most important point here is that we work to address all of these myths and misconceptions through education and transparency. So we want people to ask questions. We want people to feel comfortable, and we want them to understand the process. And we educate them so that they hopefully can, even if we only talk to them for a couple of minutes, hopefully they walk away having learned something, and having maybe a little bit more comfortability having a conversation with their loved ones or with their friends about donation, because it's really not something that a lot of people talk about unless they're exposed to it directly.
Yeah, absolutely. I mean, I think one of the things we as we go into March was Kidney Month, and this is Donor Recognition Month, is to really highlight the fact that kidney disease is really affects so many people, but it's not on our radar. It's not something we think about unless we have an immediate family friend that becomes, oh, wow, I didn't know so-and-so had kidney disease, and now they're either on the list or they're on dialysis. But that constant need is there, but we also have those who benefit and who become is able to have a better life because they receive the transplant through the gift of donor families. And I know it's hard oftentimes for families after they've donated to deal with it, but we also know that there are donor families who are out there willing to help. So how do you utilize the stories of donor families in your public address to inspire others to donate or to register?
That's a great question. Yeah. So, I mean, the power of storytelling, really. So in our volunteer kind of group, we have a bunch of different categories, I guess you can say, right? We have recipients, we have donor families, living donors, caregivers, and advocates. So it's really important that we highlight and offer a platform for these folks to share their stories. I would say the donor families and recipients are the most popular. I don't want to say popular, but they're the most sought after stories because it can really have such a huge impact on someone who might know nothing about donation. So first of all, we really encourage our volunteers to share their stories through media, whether that's traditional media, maybe the local news is doing a story about the Donor Dash or Donate Life Month. Maybe their 6ABC is doing an interview, whatever it might be. We encourage our volunteers to share in that space, and then also on social media. So I think during COVID is when a lot of people started to really heavily rely on social media to kind of get their news. And our colleague Philip, he is our digital media guru. The reach that we have sharing on social is incredible. We can reach 400,000 people with one post, one story about a donor family. And when we're at a community event, we'd be lucky to reach 200. So it's really quite important for us to encourage our volunteers to feel, quote, media ready, and also just ready to share on social and be comfortable with using those channels. And then second, I think really just sharing in public spaces. So our volunteers can be found in high schools, colleges, hospitals, healthcare centers, dialysis centers, community events. We really just houses of worship. Any opportunity that we have to share about donation and transplant and for a volunteer to share their story, we are there. For this month of April, right now, I think we're at about 110 volunteer opportunities. So that's 110 times that a volunteer this month is going to share their journey with an audience. And most of those are actually at hospitals this month. because we really want to focus in on the healthcare teams, the folks that are making it happen behind the scenes, and letting them know the scope of their impact, because oftentimes they don't really get to hear, someone standing up there and sharing their life story. So it's really great to see. We do it all year round, but during April, our volunteers can be found everywhere and anywhere that you let us. So
Yes, absolutely. And that's such a needed service in terms of being able to share stories. I mean, I think for people thinking about, should I donate, having a donor family share what they've gone through, how they've experienced, how they come to terms of making that decision, is so very important. And then on the other side, you have those who receive, and those who are recipients and have been blessed enough to have that gift of life and have that restoration now to be able to say, now I'm off dialysis, I can do things. But we also know that there are often many hurdles that patients face when waiting for a transplant. And so, Talia, can you tell us what are the biggest hurdles that family face when they come to the house, the Howie House, and tell us a little bit about the Howie House?
Sure. So the house, Gift of Life Howie's House, we're in Philadelphia. We opened in 2011, so we're celebrating our 15th birthday this year, which is very exciting. And we are a lodging facility for transplant patients and their families who are coming to Philly for their transplant treatment. And it's all solid organs, so kidney, liver, lung, heart, pancreas. So many of the families are coming from like central Pennsylvania, Delaware, southern Delaware, New Jersey, New York, just because they're where they live doesn't offer, there isn't a transplant center that can offer them the care that they need, or they're very specialized disease led to them needing a transplant, and those we have doctors with specialties that can help treat those diseases that lead to transplant. Some patients, unfortunately, are told that if they, without a transplant, they would have to go on hospice. They're turned down for transplant at centers closer to them, and really Philadelphia is sort of like their last opportunity for a second chance at life. So many patients beyond just our region might be traveling like 5, 10, 15 hours for their treatment here in Philly. And then they can stay with us during any of their appointments, their evaluation, their post-transplant follow-up. And then their loved ones can stay while the patient is hospitalized for transplant. So some families stay for one night, some stay as long as 9 months, which is incredible. But that whole time they're away from home, which can be very difficult for any family undergoing a chronic illness, a medical crisis, and transplant. Really quickly, we have 32 rooms. We have a lot of common spaces where families can meet one another. We serve dinner every night, so families don't have to worry about like how are they going to get dinner for themselves. We have on-site parking. We have a shuttle that goes to all the transplant centers, a gym, laundry facility. So we're really sort of a large one-stop shop, so that families, if they get the call even in the middle of the night, we sort of have everything that they'll need forever, for however long they need to be in Philadelphia for treatment. And then we have social workers on site to support the families during their journey. I think that the challenges and hurdles that all transplant patients and family members go through is really the uncertainty, the unknown of like, am I going to get a call? When am I going to get a call? What's it going to be like? How long am I going to be hospitalized? How am I going to handle the new organ? Am I going to experience rejection? So the uncertainty that leads to fear and anxiety, I think is one of the largest hurdles that a lot of families experience. One of the benefits of the house and then other just centers is the opportunity to like meet other families and patients. I think that every patient's situation is a little different. Every family's experience is a little different, but everyone's undergoing transplant. So to be able to meet each other, support each other, teach each other, is really one of the largest benefits of, I think, the world of transplant, and then also just being here at Gift of Life Howie's house while they're undergoing their treatment. Another common theme that I've experienced with families and patients is grief, and more along the lines of like grieving or loss of what their life used to look like, the loss of what their future is might look like or might look differently. So a lot of people feel that grief is only related to like a loss of life, but patients and families throughout the transplant process experience so many different losses, like financial stability, housing stability, sometimes being away from home, loss of relationships, a loss of physical independence. So there's so many different losses that families experience and patients experience that I think they're constantly grieving and figuring out how to adjust to what I like to say new normal, because it's never normal, but it's a new normal. And then finally, I think that caregivers and patients experience the journey a lot differently and really need supports that are similar to them, like caregivers having support from other caregivers, and patients having support from other patients, especially when families stay with us. But even, if they're local to their transplant center, often relationships in their personal life will change. So it's really helpful to have people who have a very similar outlook and experience, like caregiving specifically, or kidney patient, heart patient, whatever, where they can develop new support systems and feel like, they have something in common with others.
Well, thank you so much. I appreciate that. And you were talking about grief and dealing with the change in life. And Colleen, I wanted to pivot back to you. We know that with donor families, having lost a loved one, going through that donation process, there's always going to be that period after donation, and that they're likely will need support. And I'm just trying to have you touch on what kind of support from the Gift of Life is there for donor families once they've gone through the process?
Right, that's a great question. So we have a wonderful team in our family support services department. They're within public affairs, but our family support services team. So we kind of want, when someone becomes a donor, we don't want that to be the end of our relationship with that family. We want it to be the beginning. So we offer a very comprehensive bereavement aftercare program, which includes grief counseling. We check in with the families on a 6-month basis, ensuring that that they're okay, and kind of how they're doing with the grieving process. But then we also really encourage them to get involved in our support groups. So we have a wonderful group called Hearts of Gold, a donor family support group, and they actually cook at Howie's house quite often. So it's really nice. I oftentimes cook with them, and I just really enjoy my time with them and hearing their stories about their loved ones. And then we also really encourage our donor families to eventually, if they're comfortable, to volunteer or to at least get involved in some capacity. And I think it's down to the individual. Some people, become longtime volunteers. Like we have a husband and wife. They lost their son 36 years ago, and they are still volunteering. They go to schools in New Jersey, Pennsylvania, and Delaware, and they share Curtis's story. And that's amazing. But then there's other families that maybe they'll volunteer once or twice or do the donor dash every year, and that's enough for them. Right. So we just want to respect their choice and respect their space, but also let them know that we're here and that we have resources available to them, and that we want to have a relationship with them, and make sure that that they know that we're here.
Yeah, thank you so much for that, because it's a hard process that even for me, in looking at living donors who, they get prepared, especially those who may be unrelated, and they go through the process and they donate, and then they feel, oh, now it's over. Thank you so much. Goodbye. And so it's so important to be able to continue that support process as well. And
Right.
yeah, and so on that same line, I know the Gift of Life sometimes the OPO sometimes they coordinate donors who want to just give to someone. Can you talk about that process any at all?
I'm sorry, living donation?
The altruistic donors.
Right. So we typically don't really, I mean, in my realm, we work with volunteer ambassadors who are living
Okay.
donors, but Gift of Life, we can refer you to, Penn's program or
Mhm.
whoever's program.
Mhm.
But we used to host events that were specifically for living donors, but we haven't since
Mhm.
COVID. But with that being said, we do have a lot of living donors that are out advocating and sharing. Actually,
Mhm.
one gentleman just reached out to me today. He's going to share his story in South Jersey tomorrow at a hospital, and he's a living altruistic donor.
Yeah.
So we do utilize their time and encourage them to share, but in terms of us kind of supporting living donation, it's not really a top priority of ours.
Okay,
Right,
understand.
right.
Yeah. And just for those of you who don't, altruistic donor is someone who's willing to donate their loved ones, their own organs to someone that they don't know, and they give him back from that sense. And so they're coming forward to allow the transplant center to test them to see who is compatible with them, so that they can give a kidney to help someone that they're not familiar with. So it really is a true gift from that standpoint, although all gifts are gifts. So thank you so much. So going back to organ donation, we know that there are specific programs that are aimed at younger generations. So does your group do anything with, particularly with schools, colleges, to really capture those who are able to donate?
Oh, yes, for sure. So I think it's really important to note. So over the last year, we worked with our data team to find out this really upsetting statistic. But folks from the ages of 18 to 30 are the lowest in Philadelphia. Certain parts of Philadelphia
Hmm.
are the least likely to be registered as donors at this time. So having learned that, we've created a little kind of workforce for youth engagement over the last couple of months. A few of my colleagues and I have just started to meet to kind of see how we can tackle, that issue and kind of just see what the barriers are and, what community organizations can we tap into and how can we really break through to that group. But we already do have quite a lot of outreach in our high schools. So we have a grant program, first and foremost, that we offer grants to schools in Philadelphia for them to host or put on some type of event about organ donation awareness. Typically, that might look like a rally at their school or, like a pep rally or something, or some type of program where the students put it on and we provide them with the resources and a volunteer speaker so they can be educated on donation and transplant. We also have License to Save Lives. So anyone in any high school in our region can register for this. So License to Save Lives is just an online course, goes through the organ donation process, the myths and misconceptions, talks about OPOs, organ procurement organizations, gives you like a full background about the work that we do. And the students can get 10 hours of community service for completing it and taking the quiz. So that's a really great incentive because a lot of students need, a certain amount of community service hours to graduate. So when we throw that out there, they're like, oh, how can I learn more? So that's been really helpful. We also have volunteers sharing their stories and our staff sharing more about what we do in the schools. So driver's ed classes, biology classes, phys ed classes, really any opportunity that we can kind of, put our message in there. Like for example, driver's ed is very important because students most likely are going to hear about donation for the first time when they're getting their license for the first time. So we try to get to them before that happens so that when they are asked that question, they can make an informed decision. But then we also have phys ed teachers, physical education teachers and gym teachers that say, come in and talk about donation for an hour and, maybe play a game with them or get them engaged in some way because they know absolutely nothing. So we've done that quite a bit, and we're really excited to expand that. There's a lot of schools in our region, so we have a lot of volunteer ambassadors that are out there doing it kind of independently as well. So we're really lucky to have that support. But yeah, I mean that's really the gist of the high school outreach. And then at Howie's House, Gift of Life Howie's House, we just started a young professionals group called Gift of Life Young Friends. So it's a group of motivated, career-driven members in the community, and everyone is there to further the mission of Gift of Life through social, educational, and charitable activities. It's a really great group, but again, it's like a young professionals group. So the age group is 21 to 35. I'm very close to aging out of the group, so I'm not sure what's going to happen if I'll be grandfathered in, but it's really fun. And, there's people from all different walks of life, all different connections, some transplant recipients, donor family members, med students, nurses, people in the community that just think what we do is really cool and they want to learn more. So we have a lot of fun doing that. We just had our first meeting in February, and it was great. We had I think we're about 10 to 15 people committed. So we're looking forward to see, how this year will turn out. Last year we had a few fundraisers that went really well, and we got to meet a lot of wonderful young people who care about this mission and who want to advance it with us. So we feel very lucky to know them and to get to know them.
Dr. Scanterbury, we have about 5 minutes.
Thank you so much. So, we've heard some great stories and a lot of information about organ donation, what's being done out there by the Gift of Life. And Talia, as well as Colleen, you've told us about the Howie's House and the support that's there for patients who are waiting for transplant. And one of my other questions to Talia was, does the Howie's House continue to support the community once the surgery is over and long-term recovery? If you can give me in a minute what's done.
Sure. So we have a program called Caregiver Lifeline Program, which we developed back in 2011 as a way to support transplant patients, families, and professionals beyond just those that stay at the house, beyond Gift of Life's region and around the country and the world. So this program functions as a virtual or online support program. We have monthly webinars where we have transplant professionals share about important topics for patients and families. Our webinar in April is very interesting. It's with Dr. Montgomery from NYU, and he's going to be talking about xenotransplant, which is he's leading researcher currently on transplanting pig kidneys into dialysis or kidney candidates. He also, very interestingly, was a heart recipient, so a transplant recipient, so he'll share a bit of his personal journey. So that type of program is open to any patient, caregiver, and professional around the world. And we do get individuals from like New Zealand, Spain, Ireland. It's pretty interesting. Additionally, we also have virtual support groups for transplant patients and caregivers. They can participate again from anywhere in the country, and we do have individuals from all over of all organs and at any point in the transplant process, and they're coordinated by social workers. We also have a Facebook group for transplant caregivers.
That's what I was going to ask you. How can those who are interested get information about these programs? Is it on your website?
So it is on our website, and I can share some of the flyers and info with dialysis patient citizens if they have a group they share information with. But all of it is on our website also, which is giftoflifehowieshouse.org. And then we have a tab called Transplant Resources. We also
we got 1 minute left, so we're going to wrap it up with you telling us just in 10 seconds what you would want our audience to get from this. I mean, it's 15 seconds. How with that, Colleen?
Oh, what? Okay, 15 seconds. I think really just the most important thing is to educate yourself on donation, on the donation process, and that there are 5,000 people right now in our region waiting for a life-saving transplant. And the only way we can get that number to 0 is together. So thank you for your time, and thank you for your interest in learning about the work that we do.
And Talia?
We have lots of support and information and education for patients, families, and professionals all over the place. So connect with our website, reach out to me, especially dialysis patients, because there's a lot of resources out there to make the process feel a little bit more manageable.
Well, thank you so much. And we would definitely love your information so we can make sure that DPC can put that information for those who may be interested, as certainly be interested in hearing Dr. Montgomery. And I thank you both.